Oh, now in this MR brain with spectroscopy, we are going to see a brain mass. And we first start with diffusion weighted images, and because that's the first thing showing here, and we can see that there are patchy areas of restricted diffusion, and which are high signal on diffusion weighted images and low signal on ADC maps. And we can also see that most of it, although, is showing facilitated diffusion. And we can also see that there is hyperintensity seen in bilateral thalami, lentiform nucleus, and the brainstem. And also there are white matter hyperintensities in bilateral periventricular and deep white matter, and also in the periventricular CSF, periventricular white matter spaces, white matter regions. If we take the T1 flare images, we can see that those areas show hypointensity, and we can see that there is a mass effect on the ventricles causing its effacement, and there is some sort of a midline shift in this particular region, although the entire thing is not. And we can see there is extension to the midbrain. On the sagittal images, we can see similar findings, although and there's nothing more except that probably there might be a little tentorial ectopia, or cerebellar ectopia, or tonsillar herniation, although it's at borderline of 4.9. Beyond 5, we'll call it tonsillar herniation, but definitely something worth mentioning in your report, that you have at least seen and identified it. Always try to mention everything in the body of the report, at least if not in the impression, whatever you see. That's the rule. Do not leave out anything that's borderline or just prominent or maybe normal variant. You put down everything in the body of the report so that the opposite person knows that you have seen it and then discussed it or documented it, rather than having not seen it at all. Not documenting it is equal to not seeing, as far as legal aspects are concerned. So on the T2 flare images also, we can see hyperintensities in these regions, and in the GRE images there's no blooming in these regions, so there's no calcification or hemorrhage, but we see that there is a focus of blooming, likely an old blood product in the region of the left basal ganglia thalamic, capsulothalamic region, internal capsulothalamic region. And then on the post contrast images, we see patchy enhancement in these regions of the mass, and similar findings on the sagittal images. And the axial images. So there are multiple enhancing lesions in these areas. Uh, Now we come to the MR spectroscopy. This is a multivoxel spectroscopy. We can see the voxel has been put in the region of the mass and also in the adjacent areas in the post-contrast study. But I think even the adjacent areas have some amount of edema. So the graph, many a times you'll see this type of graph. The graph sort of things are everywhere. The NAA is reduced, and there's some lipid lactate peak, and the choline creatinine is abnormal. But this graph is like it's everywhere, and this is even more artifactual. uh, pretty bad uptake by on spectroscopy. This shows that despite all the efforts and putting the voxel in the normal and the abnormal areas, we are getting abnormal spectroscopy. This is a challenge, and this happens quite a few times in your day-to-day reporting, that you get such type of graphs. Uh, this is probably happening because the adjacent areas are also having perilesional edema. And so, based on these, we make a report that there is an irregular lesion seen involving bilateral thalamus, right basal ganglia, right internal capsule, midbrain with perilesional edema, extending to the left basal ganglia region. And we give some sort of a measurement. It is heterogeneously enhancing. Few areas within show restricted diffusion. No blooming is seen. It appears hypointense, except that old blood product in the left basal ganglia. Then it appears hypointense on T1 and hyperintense on T2. Mass effect is seen on adjacent neuroparenchyma. There is no meningeal enhancement on this post-contrast study. And then we mention everything else, what we have seen, and in the end we see the MR spectroscopy. It was everywhere, but still you have to write the things which you can be sure of, like there is a reduction in NAP, and the maximum choline to Na is 2.7, choline to creatinine is 4.33. So based on these, it is an irregular lesion involving bilateral thalamus, the basal ganglia, the internal capsule, midbrain with perilesional edema, suggestive of a neoplastic lesion that's there. It looks like a butterfly glioma, or lymphoma can be a differential. It needs histopathological correlation. And the spectroscopy, it was everywhere, but then definitely it was not negating neoplasm, so we did not think of something otherwise. And so, yeah, that is how we will report this case. Thank you.